Unit 7, Endocrine. The endocrine system is quite complex and it's responsible for many important organ functions. So there are several disease processes and illnesses which affects this system. We're going to do a brief review of normal anatomy and physiology of the endocrine system, and then we're going to go over some drug classes which are used to treat disease processes and illnesses of the endocrine system, along with applicable lab tests and patient education. So these are your objectives and these are your reading assignments. So again, this is not mandatory, but if you want to understand the endocrine system a little bit more, or if you need supplemental information, you can find them here in these chapters. So what's the function of the endocrine system? So the endocrine system controls or regulates metabolic function to maintain physiologic stability and also helps with growth and also causes some chemical reactions. So the endocrine system consists of many glands. So glands secrete hormones. So these hormones are carried to the other sites. So these are the sites of action where they exert their effects. As you can see here, you have the hypothalamus, pituitary gland, pineal gland, thymus, thyroid and parathyroid glands, pancreas, adrenal glands, placenta during pregnancy, ovary, and testicle in male. So these glands produce or secrete hormones. Hormones are substances which basically have physiologic effect on cells and on receptor sites. So it depends, their effect will be dependent on what is the receptor site, and then they have different purposes. So again, the hormones are produced by the glands, and depending on which ones we're talking about, they are basically secreted for different purposes and they have different effects on our bodies. So the negative feedback system or negative feedback loop system is basically the production of one hormone which is controlled by the level of a second hormone in a way wherein it reduces the output of the first hormone. So again, this is a system in which the production of one hormone is controlled by the levels of a second one. So a gland produces a hormone that stimulates a second gland to produce a second hormone. So in response to the increased levels of the second hormone, the source gland of the first hormone reduces production of that hormone until the blood levels of the second hormone falls below a certain minimum level. So then the cycle begins. So basically this is a mechanism that our body uses in order to control the levels of certain hormones. So this is basically to maintain homeostasis. Let's talk about the pituitary gland. So the pituitary gland is an endocrine gland that is suspended beneath the brain, right? So this is the pituitary gland, and supplies numerous hormones. It has several functions, right? And so it is vital in controlling many functions and processes in our bodies. The pituitary gland is so important, right? Because basically it has it controls several functions. So the majority of our body hormones are released from the anterior and posterior pituitary gland under the control of the hypothalamus. So in the past, the hypothalamus was thought to be the master gland that controlled or regulated other endocrine glands. Hypothalamus or hypothalamus control. So hypothalamus sits between the cerebrum and the brainstem, above and behind the pituitary gland. So the function of hypothalamus is mainly temperature regulation, fluid volume regulation, growth, pain and pleasure responses, and hunger and thirst. So the gland again is above and behind the pituitary gland and the optic chiasm. So both glands are suspended beneath the middle area of the bottom of the brain, and the hypothalamus secretes the hormones vasopressin and oxytocin, which are stored in the posterior pituitary gland. The hypothalamus also secretes several hormone-releasing factors that stimulate the anterior pituitary gland to secrete a variety of hormones that control many bodily functions. So releasing inhibitory hormones are mainly stored in the anterior pituitary, and the nerve signals are more in the posterior pituitary gland. So from the anterior pituitary, we have some of the hormones that are being released are the following. You have the adrenocorticotropic hormone or ACTH. You also have the growth hormone or GH and thyroid stimulating hormone or TSH. And on the posterior pituitary hormone, you have the antidiuretic hormone or ADH and oxytocin. The adrenocorticotropic hormone or ACTH basically targets the adrenal gland, mediates adaptation to physical and emotional stress and starvation, redistributes body nutrients, promotes synthesis of adrenocortical hormones such as glucocorticosteroids, mineralocorticoids, and androgens, and it's also involved in skin pigmentation. Growth hormone or GH regulates anabolic processes related to growth and adaptations to stressors. So it promotes skeletal and muscle growth. It increases protein synthesis, increases liver glycogenolysis, and increases fat mobilization. On the other hand, thyroid stimulating hormone or TSH stimulates the secretion of thyroid hormones T3 and T4 by the thyroid gland. So from the posterior pituitary, we have the antidiuretic hormone ADH and oxytocin. The antidiuretic hormone or ADH increases water resorption in the distal tubules and collecting duct of the nephron, so concentrates the urine and causes potent vasoconstriction. So I think we've covered this a little bit when we were talking about your blood pressure medications. Next is oxytocin. Oxytocin targets the mammary gland, so this stimulates ejection of milk and contraction of uterine smooth muscle.